Coronavirus claims more lives around the world. The people of the United Kingdom are now being advised to make drastic changes to their day-to-day existence. The Prime Minister Boris Johnson rejected criticism that his government had been slow to respond to the scale of this crisis. Mr Johnson said now was the moment to stop all non-essential contact with other people and to avoid all non-essential travel. The over 70s and pregnant women and those with underlying health conditions, they all needed to be particularly vigilant. Entire families must self-isolate for 14 days if just one member has a persistent new cough or a high temperature. From this weekend, those with the most serious health conditions should be isolated from social contact for 12 weeks. The advice came as the number of confirmed cases in the UK rose to 1,543 and 55 people are now known to have died from the virus in the UK. That's an increase of 20 on yesterday. The Chief Medical Advisor warned that the new restrictions on people's lives would need to last for a long while. Our health editor, Hugh Pym, has this first report.
This evening around the UK, the streets were a lot quieter than usual after an extraordinary intervention which will affect everyone's daily lives. This is a huge and unexpected step change in the government's response to the coronavirus crisis. The Prime Minister said drastic action was needed to slow the growth in cases. He had a series of messages, first on household isolation and those with a persistent cough or fever.
If you or anyone in your household has one of those two symptoms, then you should stay at home for 14 days. That means that if possible, you should not go out even to buy food or essentials other than for exercise, and in that case, at a safe distance from others.
There was guidance on social distancing for the whole population.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel. We need people to start working from home where they possibly can, and you should avoid pubs, clubs, theatres and other such social venues.
The over 70s and pregnant women were urged to be extra vigilant.
Infections and pregnancy are not a good combination in general, and that is why we've taken the very precautionary measure, whilst we try and find out more, to include pregnant women in the group alongside older women and people who've got pre-existing significant health conditions. We may in retrospect find that was overkill, but we'd rather be more cautionary now rather than the other way.
Many people, including millions of fit and active people over 70, may feel, listening to what I've just said, that there is something excessive about these measures. But I have to say, I believe they are overwhelmingly worth it to slow the spread of the disease, to reduce the peak, to save life, minimise suffering, and to give our NHS the chance to cope.
Isolating the sickest is to be an immediate priority.
In a few days' time, by this coming weekend, it will be necessary to go further and to ensure that those with the most serious health conditions are largely shielded from contact, from social contact, for around 12 weeks.
The NHS, meanwhile, is pushing on fast to make room for the inevitable surge in patient numbers because of the virus. At the Mater Hospital in Belfast, they're preparing specialist beds with ventilators. Nurses are being trained in using protective clothing to care for patients who've tested positive.
It's warm, it's challenging. It's like you're in the desert, really, basically, and there's no air.
We can only be in there for about 40 minutes at a time, so trying to do everything that we need to do for that patient in that time frame to keep ourselves then safe with the risks of the masks.
Hospital leaders point out that most patients will recover quickly and won't need specialist care, but they're worried about the large volume of cases expected.
I think what scares us is the potential for the numbers of patients that could come. And we don't really know how many could come at the moment, but we have been preparing for the worst, absolutely preparing for the worst. But I'm confident that we are prepared for that.
But some doctors elsewhere in the UK say the NHS isn't prepared for what's coming.
We are not ready. We are running out of masks already. We haven't even started into the crisis really. There's a crucial lack of ventilators, and even our oxygen supply might be endangered.
It's a dramatic shift in policy, and critics will say it should have happened sooner. But officials here at the Department of Health say it was only today when government scientific advisors predicted a significant escalation in case numbers, requiring radical new measures. It's the biggest public health policy intervention in peacetime. It'll have profound implications. No one knows how long it'll last and when these streets will be buzzing with life again. Hugh Pym, BBC News.
Well, as you were saying there, today's announcement marks a significant shift from the government's position last week. Minutes before the news conference took place today, the World Health Organization called for stronger measures than the UK and some other countries were taking. And officials are now convinced that the UK is on the verge of a major surge in cases, and there are genuine concerns about the impact on the NHS. Our medical correspondent, Fergus Walsh, has more details.
These images of makeshift field hospitals from northern Italy explain why such drastic measures are being taken in the UK. Coronavirus cases have overwhelmed some critical care units in Lombardy, with over 800 people in intensive care there. That's why a key aim is to slow the spread of coronavirus in the UK. It's estimated we're 3 weeks behind Italy, and if no action is taken, the epidemic here will double every 5 to 6 days.
The objectives are to really suppress the curve in order to keep it below NHS capacity, so that the NHS can cope, and to shield the vulnerable and those most likely to get severe disease, so that we protect them across this period.
The aim is to reduce deaths and minimise suffering. 4 out of 5 people will have a mild illness, but a significant minority will need hospital treatment due to breathing problems and pneumonia. 1 in 20 of those infected may need intensive care. The UK has around 5,000 intensive care beds. If there's too much demand, then patients could die if there aren't enough ventilators, and it could also cause deaths in patients with other serious conditions.
If the NHS became overwhelmed in any of the 4 nations, if the intensive care units got to the point when they were overwhelmed, then people would die from indirect deaths because they did not have the ability to get medical care.
The government is relying on sophisticated disease outbreak computer modelling to predict how best to control the pandemic. It's thought there could already be up to 50,000 cases of coronavirus in the UK.
These measures are going to have a major impact on society, indeed even on health in other ways. There will be unintended consequences. They're going to shut down a large chunk of the economy. I think you have to be very sure you need them before you introduce them. Neither do you want to leave it too late.
Government policy has shifted because new modelling suggested there would be a catastrophic epidemic with up to 250,000 deaths predicted unless attempts were made to suppress the outbreak here. But an effective vaccine could be 12 to 18 months away.
Fergus is with me now. Fergus, I'm going to pick up on that last point about projected deaths, which will have no doubt alarmed lots of people. What's the government been told behind the scenes by its own advisors that's prompted this dramatic shift in policy?
It's new modelling that's come out of Lombardy in the past few days, just showing the level of intense impact on intensive care units from the virus. And the advice was that if we carried on with the policy that was there only last week to mitigate and not completely suppress the outbreak, that we would have this catastrophic epidemic with the prediction of potentially up to 250,000 deaths. Now, this obviously only predictions, but by trying to suppress the virus now and putting in these extraordinary measures, the hope is that those deaths could be reduced to the thousands. Now, the problem with this is there's no exit strategy, and this applies to all countries around the world who are involved in lockdowns or other restrictions, because as soon as you lift those restrictions, the virus can come back again. It's thought the current wave could peak in about 10 to 14 weeks, but we don't have any effective treatments. A vaccine could be 12 to 18 months away, so we really are in this for a long haul, and it's how much society can bear to put up with in the coming months.
Fergus, for now.